Hi, I'm Kathy Kemle. I am a physician assistant from Macon, Georgia. I'm speaking to you from the 2016 AAPA conference in San Antonio, Texas. And it's really a pleasure to be here, and I would first like to thank the folks at Clinical Advisor for giving me this opportunity to speak with you. It's wonderful to have a chance to talk about something that's really near and dear to my heart. I just came from the AAPA House of Delegates, where there was a great deal of deliberation about issues that are facing our profession. And it led me to think about some of the things that we value most as physician assistants, or those things that I find most important in our profession. And far and away, what I see as our strength as PAs is our emphasis on our patients. They are always the ones who matter. It's not about me, it's not about what I do. It's about the people I care for. One of the stories that I will be sharing here at the conference, but one I particularly would like to share with all of you as well, was a 36-year-old African-American woman who was diagnosed with widely metastatic cholangiocarcinoma. She presented to our hospital with intractable abdominal pain, nausea, vomiting, and severe emotional distress. She had been previously fairly healthy, and her diagnosis was a great surprise and shock to her and her family. She was supported by her mother. She also had two children, a 17-year-old son and a 10-year-old daughter. However, despite all our best efforts, and we provided all the palliative medicines in our armamentarium, everything from morphine to ondansetron to dexamethasone to lorazepam, everything we could possibly think of to help with her nausea, vomiting, and pain, and escalated her dose over the course of about a week. Despite all our best efforts, she continued to have a great number of symptoms. And so I thought, we've done all the things that medical science can do, except for one thing. And that was to speak to her spirit. And so the counselor and I went in, sat down, and talked with her, asking her, what is it about this illness that has impacted your life? And what are your goals? What is it you would like to see? What is this stealing from you that is important to you? And she was able to tell us at that point that she wanted to see her son graduate from high school. This was in February. Graduation was in May. So we knew that it was impossible, unless there were a miracle, for her to live until May. So we decided to help have the graduation ceremony early. And in fact, we called the school, explained the situation. Her 10-year-old son was about to be suspended because the school authorities did not know of his mother's illness. And we were able to arrange to have the graduation in the hospital with all of the family and many of the staff who were caring for her in attendance. I know we had well over 800 people there. She was positively delighted. Biggest smile I'd ever seen on anybody's face. And we were also fortunate the members of the community supported us. We received cakes and all sorts of things from various people. So her son was allowed to graduate early. She attended the ceremony. She actually lived an additional 6 weeks, which was very unexpected. And we had to reduce her medication burden because she was so well controlled she didn't need them. So look beyond the obvious. Look to the whole of your patients. I think that's one of the very best and most important tenets of our profession. Thank you.